Welcome to Elsevier Student Life's Whiteboard video series, Questions for Nursing Students. This week's featured practice question is from Elsevier's Nursing Key Topics Review for Pathophysiology. Let's get started. Which client is most directly impacted by the function of immunoglobulin E? 1. A client requiring a blood transfusion. 2. A client experiencing a reaction to a bee sting. 3. A client whose immune system has been activated. Or 4. A client who has been exposed to a bacterial infection. First off, it's important to note the keyword most in the question. This is a tricky one as immunoglobulin E is one of 5 classes of antibodies produced by the body. Immunoglobulin E is unique because it's concentrated in the lungs, skin, and mucous membranes, providing the primary defense against environmental agents. It reacts with certain antigens to trigger the release of chemical mediators that cause anaphylactic hypersensitivity reactions. Knowing this, let's use our key nursing knowledge to perform the process of elimination. We know the answer is not number 1 because immunoglobulin M is associated with ABO blood type incompatibility. It can't be number 3 because immunoglobulin G is made because of immune response. And the answer is not number 4 because immunoglobulin M guards against both viral and bacterial invasions. The correct answer? Number 2. Immunoglobulin E causes the release of histamine and other chemicals triggering an allergic response. And there you have it. Thanks for watching. Now make sure to subscribe to our channel so you never miss another NCLEX Prep question. And follow us on social media for more support to succeed through nursing school.